Coronaviruses are a family of viruses that make humans sick. These include some forms of the common cold, as well as more serious diseases like SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. The new coronavirus disease, officially known as SARS-CoV-2, was first identified in Wuhan, Hubei province, China, in late 2019 and has since spread around the world. This disease is very new, and humans have little or no immunity if they are infected with the virus, which is easily spread from person to person. Most people who become infected with COVID-19 will experience mild symptoms and recover without special treatment. However, some people will get very sick and require treatment in hospital or even intensive care. Globally, governments have responded to the pandemic with strategies of restrictions designed to limit close contact between large groups and slow the spread of the virus. Australia has been very successful managing the virus through state-based public health orders. These are temporary laws used to enforce health directions during emergencies. They need to be renewed regularly and are revised to match the level of risk to the community. Australian states and territories are managing active COVID-19 cases with a suite of public health measures that create barriers stopping the virus spread throughout the community and to protect vulnerable populations. Measures in place will change over time in response to the need to control cases as they emerge. You will have seen through 2021 that COVID-19 can quickly re-establish itself in the Australian community. Government restrictions have successfully contained the rate of community spread and allowed us to get medical assistance to those in need quickly. It is very important that everyone continues to abide by social or physical distancing measures advised by government health officials. As Australia enters a phase of COVID normal, it is important for food businesses to ensure operations work to maintain food safety and reduce the risk of transmitting COVID-19. COVID-19 is caused by the severe acute respiratory syndrome coronavirus 2, which can infect people of all ages. While most infected people will show mild symptoms that will resolve without special treatment, around 15% of people will have severe infections and 5% will require treatment in a hospital intensive care unit with assisted breathing ventilators. COVID-19 is highly infectious and easily transmitted from person to person. It is novel, which means humans have little to no immunity to COVID-19, so even people infected but not displaying symptoms will still carry the virus and be infectious for up to 2 weeks. Most people exposed will experience some ill symptoms, for example fever, shortness of breath, sore or scratchy throat, and cough. Until a vaccine can be distributed to achieve population-wide immunity or herd immunity, everyone must continue to follow the advice of public health officials around social distancing to manage the risk of outbreaks. As the pandemic continues, the virus will evolve through natural selection. This has led to the World Health Organization designating common strains as alpha, beta, gamma, delta, and so on to assist health authorities better tailor their responses. Delta strain was the most common strain circulating globally at the time of writing. It is characterized by a much higher infectiousness, more than twice as infectious as the original wild strain first identified in China and has slightly different symptoms. Human coronaviruses are spread from someone infected with COVID-19 virus to other people through contaminated airborne droplets spread by coughing or sneezing in close proximity and in enclosed environments, or by contact with contaminated hands, surfaces, or objects. Studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours up to several days. There is no evidence to date to suggest that food is a source of route of transmission for any coronavirus, including COVID-19. The most likely way of becoming infected with COVID-19 is to have close contact with a person who has COVID-19 but is yet to show symptoms, known as asymptomatic. Being in close contact is typically spending time with an infected person face to face for at least 15 minutes or being in the same closed space for at least 2 hours. The most common symptoms of COVID-19 are fever, cough, a sore scratchy throat, and shortness of breath, headache, and runny nose. Other symptoms may be present. These may include loss of smell, loss of taste, muscle pain, joint pain, diarrhea, nausea and vomiting, and loss of appetite. The New South Wales Ministry of Health recommends that everyone with respiratory symptoms or unexplained fever should be tested for COVID-19 as soon as possible. The New South Wales government has deployed testing clinics throughout New South Wales to make it easy to get tested. Medical advice suggests people exposed to COVID-19 generally begin to show symptoms after 5 to 6 days, although it can range from 2 to 14 days. This is why it is important to self-isolate if you receive advice that you are a confirmed case or a close contact of a confirmed case. Confirmed cases are required to self-isolate until you receive medical assessment confirming you are non-infectious, which will include confirmation and at least 14 days have passed since your first COVID-19 test, which was positive, and there have been no symptoms of the acute illness for 72 hours. A complete breakdown of patient self-isolation release criteria can be found in your course resources. Self-isolation requires the patient to remain at home and avoid spending time in the same room as other people as much as possible. They must not leave their home except for health reasons and should arrange essentials to be dropped off through their personal networks or New South Wales Health contact tracing teams. Confirmed close contacts are also required to self-isolate for the next 14 days from the day you last saw the infectious person. Home isolation applies to all close contacts, even if you are currently feeling well. The full list of COVID-19 symptoms can be found at the New South Wales Health website. A link to an online symptom checker for COVID-19 may be found in your course resources. In Australia, the people most at risk of getting COVID-19 infections are those who have recently returned from overseas and been in close contact with someone who has been diagnosed with COVID-19. There is evidence of community spread of COVID-19 in the Australian community, so contact precautions are advised. Those at greatest risk of serious infection are people with compromised immune systems, such as cancer, people with diagnosed chronic medical conditions, such as diabetes, high blood pressure and heart problems, elderly people, and Aboriginal and Torres Strait Islander people, as they have higher rates of chronic illness. It is important to remember that even healthy young adults can have severe disease caused by COVID-19. The best way to protect yourself from COVID-19 is the same as any other respiratory infections. Practice good hygiene by getting vaccinated when eligible, making sure to clean your hands thoroughly for at least 20 seconds with soap and water or an alcohol-based hand rub, cover your nose and mouth when coughing and sneezing with tissues or a bent elbow, placing a used tissue in the bin straight after using it, Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching your face as much as possible. And wear a face mask, particularly when it is hard to maintain 1.5 meters physical distance from others, in areas where there is community transmission, in high-risk enclosed areas such as public transport, supermarkets, shops, and places of worship, and when caring for or serving vulnerable people. You can find a link to an online video on hand washing and a downloadable poster on hand washing in your course resources. There is also a 24/7 national coronavirus helpline if you need help or more information about COVID-19. There is no evidence to date to suggest that food is a source or route of transmission of COVID-19. There is no evidence to suggest people will get infected by swallowing COVID-19 in or on food or drink. It is important to continue to prepare food safely to make sure you or your customers do not get sick from other food poisoning bacteria like Salmonella and Campylobacter. You can find a link to some key tips on this in your course resources. It is also very important to routinely wash hands during food preparation, especially between handling raw and cooked foods, and use separate areas or surfaces to prepare raw and cooked foods. The Food Standards Code already requires food businesses to take all practicable steps to prevent contamination of their food service or processing environment. In addition to existing food safety requirements, Section 3 outlines additional measures that should be in place in restaurants and cafes to minimize the community spread of COVID-19. 6 different vaccines have been approved globally for safety and effectiveness, stopping serious disease and death from COVID-19. More will likely be approved as they pass safety trials. 2 have been approved for use in Australia by the Therapeutic Goods Administration, or TGA. However, vaccination has not been confirmed to prevent all infection or transmission to unvaccinated individuals. Therefore, it is essential that once you are vaccinated, you continue to follow public health advice to limit the spread during outbreaks. Public health orders for gathering and movement requires operators of all food and drink premises, including both dine-in and takeaway restaurants and cafes, pubs and clubs, cellar doors, microbreweries, registered clubs, small bars, and casinos to implement a COVID-19 safe plan. Hospitality businesses such as cafes, restaurants, pubs and clubs, food and drink premises, registered clubs, small bars and casinos must register their COVID-19 safe plan and display a COVID safe sticker to their customers at their shopfront. Links to templates for restaurants and cafes and pubs and clubs can be found in your course notes. Managers and food safety supervisors should ensure that food handlers are adequately trained in implementing the COVID-19 safe plan. COVID-19 safety marshals must be appointed for cafes, restaurants, and food courts and pubs and clubs where there are more than 250 people on the premises. Food and drink premises with less than 250 people on site are encouraged to have a COVID-19 safety marshal. The marshal should be easily identifiable and is responsible for ensuring all aspects of the COVID-19 safety plan are being adhered to, including overseeing social distancing, cleaning, and ensuring the accuracy of record keeping. The following sections outline the key content areas in COVID-19 safe plans. The New South Wales Government determines the level of restrictions required based on the advice of the New South Wales Chief Health Officer and Ministry of Health. You should regularly review the permitted capacity at the New South Wales Health website. A link to this is provided in your course notes. Restrictions are based on balancing risk and providing for the community to re-engage in activities. For food services and hospitality venues, customer capacity is dependent on population risk and typically ranges from takeaway only to 1 person per 4 square metres for both indoor and outdoor dining, or 1 person per 2 square metres. The square metre rule is designed to manage the risk of close contact based on the 1.5 metre distance of expelled air from talking. The public health orders for gathering and movement require businesses to keep digital records of people entering their premises. This is so the Department of Health can conduct contact tracing in the event a positive test is returned for a customer, staff member, or contractor. Since the 1st of January 2021, the New South Wales Government has required all eligible businesses to use the Service New South Wales QR code to improve the speed of contact tracing. You must implement the New South Wales Government's Service New South Wales QR code check-in, ensure your record-keeping system captures customers' names, phone number, time and date of entry and postcode, keep records for 28 days, provide records to the Chief Health Officer or delegated authority upon request. It is highly recommended the COVID Safety Marshal confirms all check-ins to prevent customers entering incorrect names or phone numbers. Good personal hygiene is the most important thing people can do to stop the spread of the virus. There are 4 personal hygienic practices for food businesses and food handlers to be mindful of. Hand washing. Wash your hands regularly and thoroughly with soap and water for at least 20 seconds, or use an alcohol-based scrub or sanitizer containing 60 to 95% alcohol. This is especially important after blowing your nose, going to the toilet, and before and after eating. A downloadable poster may be found in your course resources. It should be placed in the bathroom to remind all staff and customers of the importance of maintaining appropriate hand washing practice. Avoid touching your face. This is important because virus-containing droplets can be transferred to your eyes, mouth, or nose, where they can infect you. Maintain good respiratory hygiene. Cover your mouth and nose when coughing or sneezing with a disposable tissue that is placed directly into the bin once used, or a bent elbow. Avoid close contact with anyone displaying cold and flu-like symptoms. These people may be infected with COVID-19, and if you spend time near them, you may become a close contact. Wearing a face mask is mandatory if you are working in a food business where you are in contact with customers, particularly indoor venues, as these venues have a higher risk of transmission of COVID-19. For food and drink premises workers, this means keeping personal equipment, including uniforms, clean and regularly replacing gloves, hair nets, and face masks. All food and drink business employees should ensure they wash their hands with soap and water frequently. In addition to usual hand washing requirements required by Standard 3.2.2 of the Australian-New Zealand Food Standards Code, between handling foods, going to the toilet, after returning from breaks, etc., employees should also wash their hands after completing cleaning and sanitizing tasks and handling items used by customers like money, cutlery, and condiments. Food safety supervisors should ensure their premises have sufficient personal hygiene supplies at all times, especially in bathrooms, and encourage all employees to implement the suggested personal hygiene practices. Food handlers are already required to follow Standard 3.2.2 of the code and must not work in food handling activities when they have symptoms of gastrointestinal illnesses and or other conditions when there is a reasonable likelihood of food becoming contaminated. Conditions are defined in Standard 3.2.2 to mean an infected skin lesion or discharge from the ear or nose or eye. Conditions include a number of common ailments like the common cold or influenza that result in respiratory illness in humans. As COVID-19 also causes respiratory illnesses in humans, it is also considered a condition for the purposes of Standard 3.2.2. However, the following additional management principles apply with COVID-19 that are different to other conditions for employees, staff, and contractors in food and drink premises. Persons confirmed as positive COVID-19 or close contacts of those confirmed as COVID-19 positive must not attend work. Such people must self-isolate for a period required for a confirmed case or close contact, regardless of the severity of symptoms experienced or whether they inform that symptoms have resolved. Persons who have been in an area determined to be a COVID-19 case location must self-isolate for a period of 14 days before returning to their workplace in New South Wales. There are limited exemptions or exceptional circumstances. Such persons are advised to inform their employees as soon as possible electronically or by phone of their result and the resultant mandatory self-isolation timeframe. Self-isolation periods for COVID-19 are mandatory and enforceable under the Public Health COVID-19 Self-Isolation Order of 2021. Managers and supervisors should inform their staff of appropriate leave provisions or sick leave entitlements if they test positive for COVID-19 or a close contact of a confirmed case. If you feel symptoms that may be related to COVID-19, for example, fever, cough, sore or scratchy throat, or shortness of breath, you should get tested for COVID-19 and not attend work until the results are received. Businesses are encouraged to implement temperature screening procedures for staff and customers. People screening over 37.5 degrees Celsius should be excluded from the premises. Managers and food safety supervisors should make their staff aware of and encourage the use of the COVID Safe app. Managers and supervisors are required to notify SafeWork New South Wales of confirmed COVID-19 cases arising out of work. COVID-19 can live on surfaces touched by infected persons, so it is important to maintain high levels of cleaning and sanitizing to minimize the risk of cross-contamination of COVID-19 in your business. The New South Wales Food Safety Supervisor course already contains a standalone module for cleaning and sanitizing that food handlers should follow to minimize the risk of foodborne illness in their business. In addition to the module, food and drink premises should, where practicable, implement the following to minimize the community spread of COVID-19. Keep single-use items such as straws and napkins out of reach of customers. These should only be provided to customers upon request. Do not use cutlery, serviettes, coasters or menus in communal containers. Where possible, single-use cutlery is suggested. Remove condiments from communal areas and only provide on request. Non-disposable crockery, cutlery, glassware, condiments are permitted only when cleared after each course and washed preferably in a commercial-grade dishwasher or glass washer. Ensure tabletop menus are laminated and sanitized after each use, or use general non-contact signage or online menus or QR codes to display your menu or have single-use paper menus available. For takeaway services, place menus outside the venue. Implement more frequent sanitizing of all surfaces, particularly frequently handled and touched surfaces such as FPOS machines, payment devices, counters, trolley handles, self-service areas such as drink fridges, packaged confectionery display counters, etc., fridge and coolroom handles, door handles, railings, display cabinets, switches, power points, and charge ports. Surfaces used by customers, such as tables and chairs, must be cleaned between seatings. Dispose of single-use items, such as cutlery and napkins, immediately once customers have finished with them. Encourage contactless customer payment. Remove any self-service buffet-style food service areas and communal water or drink stations in favour of staff-managed services, where staff serve buffet-style food to customers. These staff may wear face masks as an additional protective measure. The food safety supervisor or manager should review cleaning and sanitizing schedules and staff understanding of cleaning and sanitation protocols, including making up correct sanitizer concentration and ratios, for example, bleach dilution or disinfectant or water ratios, and ensuring additional surfaces, commonly touched and reusable items are included and correctly cleaned and sanitized. Please note, cleaning and sanitizing chemicals must be used strictly in accordance with the manufacturer's advice. An example cleaning and sanitation template for COVID-19 has been developed and is available in your course resources. Most people will be aware of the social or physical distancing advice to maintain 1.5 meters from other people as much as possible. This is because water vapor breathed, coughed, or sneezed into the air is unlikely to travel further than this, making social distancing a key control measure for COVID-19. A poster on social or physical distancing may be found in your course resources. Food and drink premises need to accommodate social distancing for both dining areas and behind the counter, including kitchens and food storage and preparation areas, to limit the potential for workers, contractors, and customers to be in close contact with each other. Suggested measures are: avoid contact greetings. Do not shake hands with or hug co-workers. Modify processes behind the counter, including in the kitchen, to limit workers having to be in close contact as much as practicable. You should, where possible, assign people to specific workstations to minimize the need to go into other spaces. Implement processes so front of house workers can collect food without needing to go into food preparation areas. Consider using physical barriers where practical, such as plexiglass around counters involving high volume interactions with customers. All staff are required to wear a face mask. Limit signatures required for receipt of foods and other goods from suppliers. Suggest that photos of goods received and/or electronic confirmation as an alternative option. Stagger worker meal break times to minimize the risk of close contacts. Limit staff meetings and trainings to essential business operations or hold sessions electronically. Dining areas, front of house. Businesses must determine how many people can dine in, have a longer contact experience in the premises at any one time. This is calculated using the 4 square meter rule for the dining space of the business. The larger the space, the more people can fit. For example, a 40 square meter space can hold 10 people, or a 160 square meter space can seat 40 people. Public health orders for gathering and movement may provide additional advice on maximum patron numbers. These numbers change periodically. It is important to check the most recent order to ensure your business implements appropriate patron limits. For example, the public COVID-19 restrictions on gathering and movement Order number 3 provides that if your business has sufficient area in square meters for patron numbers greater than 50 people, you are limited to 50 people maximum. The same order also directs that an individual grouping of people must not be greater than 10. Once a business has determined its maximum number of dine-in patrons, this number should be placed on the door of the premises for patron advice. This number should also be added to any websites or other social media resources used to advertise the business. This sign should politely inform patrons that the business must refuse entry to additional patrons once it reaches its maximum patron limit. The business should implement the following measures to provide for social or physical distancing within its premises: marking 1.5 meter gaps in standing areas for customers to queue, arranging dine-in tables to ensure a 1.5 meter distance between tables, and, where practicable, placing 1.5 meters distance between dine-in customers at each dine-in table. Businesses should implement a time-based booking system for dine-in customers and encourage patrons to make online or phone bookings. Walk-in patrons are permitted, but bookings should be encouraged. Businesses need to clean dining areas and customer furniture, like chairs and tables, between dine-in customer sittings. Signs should be placed at entry points to the food business, instructing customers not to enter the shop if they are unwell, for example, coughing, sneezing, fever, runny nose, etc. The sign should also state that businesses have the right to refuse entry to such persons. Remove furniture from takeaway pickup locations to reduce the likelihood of customers congregating with each other. If practicable, set up separate exit and entry points and separate order and collection points to minimize contact between persons. Encourage customers to use PayWave and credit cards in preference to cash. If applicable, businesses should limit the number of passengers using a courtesy bus. Drivers should be made aware of their COVID-19 obligations. Social Distancing Toolkit. This section provides an overview of the possible interventions the New South Wales Government may mandate from time to time, and in specific areas to control community transmission. It is important to regularly check changes to your local requirements on the New South Wales Government's COVID-19 Updates webpage. Masks and face shields are important because they catch larger water droplets from your mouth and nose. In areas of widespread community transmission, face masks may be required for staff working in food businesses, especially inside. If you are required to wear a mask, it should fit closely under your chin and over your nose to be most effective. Check with the manufacturer's instructions on how long your mask can be used for and dispose of used masks in covered waste bins. Reusable masks should be washed on a hot cycle to kill the virus. In serious cases that require lockdowns, food businesses may be permitted to trade for takeaway only. In this scenario, you should ensure social distancing displays are prominent and, if possible, arrange takeaway pickup locations outdoors. You will also need to have customer limits on entering the business to order. Food and drink premises need to accommodate social distancing for both dining areas and behind the counter, including kitchen and food storage and preparation areas, to limit the potential for workers, contractors, and customers to be in close contact with each other. Section 3.7 provides a list of many of the requirements that could be mandated to manage risk. Social distancing is controlled by maximum customer numbers and the 1 per 4 square metre rule. Always check gathering and movement orders for up-to-date maximum numbers. Larger venues may have capacity limits permitted by sections, which may or may not include staff in their numbers. COVID-19 is a new virus that causes respiratory infections in humans. Anybody can get sick, as humans have little to no immunity. The key means of limiting the spread of COVID-19 are getting vaccinated with an approved vaccine, effective and frequent hand washing, regular cleaning and sanitation of surface and items, respiratory hygiene, cough or sneeze into a tissue or bent elbow. If using a disposable tissue, dispose of it immediately after use. Avoid people who have cough or runny nose. Stay home if you feel sick, for example, fever, sore or scratchy throat, shortness of breath, etc., and get tested for COVID-19. Once tested, stay at home until told by health officials otherwise. Practice social or physical distancing. There must be at least 1.5 meters of distance between you and other people. Wearing a face mask when it is hard to maintain 1.5 meters physical distance in areas of community transmission, in high-risk indoor areas such as public transport, supermarkets, shops, and places of worship, when working in customer-facing roles, and when caring for or serving vulnerable people. For food businesses, operate according to the COVID-19 Safe Plan. Appoint a COVID-19 safety marshal for your premises. Keep electronic entry records for how your business operates according to its COVID-19 Safe Plan. Provide these records to an authorized officer upon request. Train your staff in how to operate according to the COVID-19 Safe Plan. A free online course has been developed to help educate staff about COVID-19. Calculate how many people can be seated inside your premises at any one time using the 2 square metre rule. Amend your operations to provide for social or physical distancing for both front of house and back of house practices, and implement frequent cleaning and sanitation of items and surfaces touched by customers. Implement employee health practices to limit the spread of COVID-19.